Okay, Suman, we are live now.
Yes. Good evening, doctors. I Shuman on behalf of Shield Healthcare, welcoming you all today with another interesting session on PCOS, that is lifestyle modification of PCOS. And our guest speaker is Dr. Haripriya Singh, madam. Madam is associated with the Sri Krishna Seva Sadan Hospital, Lakhisarai, Bihar, and madam completed her MBBS, MSO, OG, MRCOG, and DNB. So, So in this short introduction, I request Madam to take over the session, and meanwhile, I request all the participants for their active participation, and please post your queries on the QA dashboard of the Shield Connect page. So once the talk will be over, we shall have a short discussion on this topic with Madam. So thank you, Madam, and over to you, Madam.
Okay, a very warm welcome to all of you and a very good evening. And today we have a very interesting topic to talk upon. First, I would like to thank Shield Connect to giving me this opportunity. And coming to the topic, what we have to discuss today is lifestyle modification in management of PCOS. And as we all know that nowadays for every disease, what we suggest them is lifestyle modification and behavioral changes, especially when it comes to PCOS. So what lifestyle changes, mainly we tell them that we are going to discuss. We know about the drug treatment and what all other medicines we prescribe for PCOS. But basically what I'm going to talk today is about especially the lifestyle changes. Coming to the introduction, we all know what PCOS is. It is also called as polycystic ovarian disease or polycystic ovarian syndrome. And as per the new data of what we have, that it is a very, very common disease nowadays, and it is seen on almost every age group of the women. And as per the recent data, what we have received is that it is so common that it is seen in at least 35 to 40% of the population in India. And it is very much associated with obesity and a sedentary lifestyle. And we have seen that 80% of obese women, they have PCOS. And if we investigate, we will find out that some degree of PCOS is already existing in their body in some form. So it is, as I discussed earlier, as I told earlier, that it is very common and seen in all the age groups of the women. So starting from the teenage period, starting from the adolescent period, and coming to the reproductive and even the post-delivery or postpartum period, even if a woman has already, she's in her mid-age, like 35, 40 years, that woman also, if we have investigated some sort of PCOD complications or symptoms they have in their body. Although we know that what PCOS holds for, there are mainly three things what we see in the pathophysiology, that it is associated with hyperandrogenic symptoms, hyperinsulinemia, and the most important thing, insulin resistance. And that is why the maximum symptoms and the maximum disease problems what we see in PCOS is because of the insulin resistance what is existing in PCOS. As I discussed earlier, obesity, again, it is very much interrelated, but it is also not very true that it is not seen in a lean and thin patients. So we have seen two types of PCOD pictures. Mostly they are obese in 80% cases, but yes, 20 to 30% of the cases we have seen lean PCOS also. So we cannot deny the fact that even if the patient is lean and thin, she can be suffering from PCOS in some or the other age gap of her age life of their reproductive phase or any adolescent phase. Obesity plays a very significant role in determining the clinical manifestation and metabolic disorder what we see, especially in PCOD patients. Especially if a woman who is obese and if her BMI is more than 30 kg per meter square, those are more prone to develop the complications and more associated with PCOS syndrome. And especially a woman who has a central obesity, that is the fat deposition when it is mostly seen on the central part of their body, that itself signifies that the woman is already having a good degree of insulin resistance, and that is why they are more prone to develop PCOD even early and later in their life. So again, it is very important. Many patients, they come to our clinic asking that, ma'am, is there any cure for this particular disease? Because any woman for a random symptom, if they come and if they have some menstrual irregularities, if they tell that, okay, we have a scanty bleeding, and if we put a probe on their abdomen for a scan and we find out that, okay, she has a polycystic feature. So it is so common that even in teenage groups, for acne and hirsutism, irregular cycles, if we just do a simple scan and we find out that the woman is already having a polycystic ovary. So it is a multifactorial disease and it is always affecting a multi-organ. I mean, at every organ almost is getting affected. And it is, we all know that it is an endocrine disorder. It is a metabolic syndrome which is there existing in this particular disease. So it is associated with multiple diseases. And that is why we have to make sure that we diagnose it earlier, we counsel the patient about it, and we take a proper step when it is required. And it is very much commonly seen with women already having an ethnicity. I mean, a woman who is from an American or African breed, or if at Asian, especially Asian countries, it is very commonly seen because of the food habit or maybe because of the sedentary lifestyle what we have. And it is seen that somehow it's some aspect it is genetic also. If suppose a woman is PCOS, the mother is PCOD, then the daughter is also prone to develop PCOD because of the maybe the eating habit what she has followed since her childhood. She has not been looked after properly, what food habit she's having, her lifestyle, whether she's having any physical activities or not. So as we can see on the screen that itself, PCOD carries a multiple disease which is associated with this. So we have to definitely take a very proper care of this particular syndrome and treat it in a very nice way and in very early stage of the life of the woman. So clinical features, as I told, it depends upon the age group of the woman and how she presents to our clinic. If she's an adolescent, teenage, she might come with hirsutism, acne, some hyperpigmentation at the nape of the neck, what we call is acanthosis nigrans. And many women, they will have an ovulatory cycles, so there can be hypoovulation and ovulatory cycles, irregular cycles. And most of the patients, they come walk in our clinic, especially teenage girls or early adolescent girls with complaints of, irregular cycles. And they tell there is very scanty bleeding when they get their menses. It's not very, they don't bleed properly. So these are very common symptoms what we see. And this is all androgenic features. What is the reason behind all these symptoms? Coming to the gynecological, as I told you, irregular menses and all are very common. When it comes to the reproductive age group, a woman will definitely have issues conceiving because most of them are not ovulating only. So we have to counsel them, and we cannot even put those women on any hormonal pills or any OCP pills because we want them, they are keen to conceive. So in that particular cases, we are supposed to prescribe them ovulating drugs like ovulation induction drugs, and we have to monitor the cycles and see whether she's ovulating or not. Coming to the metabolic disease process or the syndrome, what is associated with PCOD, like insulin resistance. So that itself can lead to multiple diseases. Like if suppose she's obese, she's already, her BMI is more than 30, then she's prone to develop diabetes mellitus type 2. She can have hypertension. She's prone to develop any cardiovascular accident. So she's having high risk of, heart attacks and heart diseases. She's prone to develop any, hypothyroidism and many other diseases. She's prone to have depression and stress and anxiety disorders. So coming to the pathophysiology, as I told, there is mainly three things what we see in PCOD. One is insulin resistance, hyperandrogenism, and the most important is hyperinsulinemia. So these are few phenotypes what we have categorized depending upon the symptoms of the PCOD. In between, there are 4 phenotypes, and which shows that if suppose a woman is having hyperandrogenism and hirsutism, but it is absent in one particular, like in phenotype D, what we have seen, that hyperandrogenism and hirsutism is present, but it is absent in phenotype D. Same ovulatory dysfunction, it is absent in phenotype C. And PCOD morphology, what we see in the ultrasonography, it is absent in phenotype B. Coming to the medical history, a woman walking to us in the OPD, we have to make sure we take a very detailed history, how it developed and what is her lifestyle, what is her dietary habit, what all behavioral habits she has, whether she's into smoking, whether she takes alcohol, what food habits she has, how is her physical activity pattern. I mean, how many days in a week she works out, and what kind of food she takes. And we have to make a proper history, and it has to be noted properly. And yeah, we have to note down the ethnicity and everything. And obviously we have to ask about any drug history if she's on. So coming to the lose weight, any patient, they come to our clinic, and if suppose she's planning to conceive, the very first thing we tell, and we find out that, okay, she's in a obese or pre-obese category, we first tell them that, okay, you have to lose some weight. So is it so simple to tell them to lose weight? And because we being a doctor, we know it is so difficult to lose weight. So we have to always, if we tell them any advice, then we have to give them a solution as well, because they are already stressed because of the other factors that, okay, I'm not conceiving. They have so much of social family pressure and everything, and they come for a help to our clinic. And if we just tell them, okay, you lose weight and you will conceive, that is not going to help. So we have to counsel them in a very proper way, and we have to give them proper advice and solutions to the problem as well. So that is why I am here, and we are going to talk on this particular thing, which is lifestyle modification, because we have seen multiple of presentations on what is the treatment, what are the drugs, myoinositols and everything, how it helps. So I'm not going to detail about all that, because we don't have that much time. So what we are going to talk here today is lifestyle modification. What are the things which you will modify in your day-to-day activities? What are the behavioral changes you will get in your life, so that it will help in the outcome of the disease, and it will give you a very faster recovery. So what advice we give to the obese patient is that, if at all, if they can lose at least 5% of the body weight, that too in the period of 6 months. So we are not telling the patient to go for a very fast weight loss or any crash diet course to lose the weight. It has to be very gradual, and it has to be in a very sincere way. I mean, the patient should not be like, directly they should jump for any fat diets, and they should go for any keto diet or such kind of things, and they should not land up in the problem. So we have to counsel them very properly, and if needed, the approach has to be multidisciplinary. If needed, we can take a help of a dietitian. We can definitely refer our patient to a dietitian, and they will give them a very nice diet chart for the PCOD patients. Weight loss, obviously, we know it decreases the insulin resistance, and it improves the symptoms, and androgen levels are also decreased. So overall, it will improve the quality of the oocyte, and the ovarian function will restore. And many patients and many studies, they have shown that many patients, those who have reduced at least 5 kgs of weight loss, that is 5% of the total body weight, that also has helped them, and that has led to spontaneous conception. Yeah, there are many drugs which helps in weight loss. There are many drugs which decreases the complications of obesity, like statins and all. Low dose aspirins also we advise to very morbidly obese patients. So components of the lifestyle changes, what we mainly see here is, we will ask the patient what kind of lifestyle they have, whether it is a sedentary lifestyle, how much activities they have in day to day, and eating habits we have to look for. And weight gain factors, we have to see that what are the things what they are consuming, how much carbohydrate they take in a day. We have to ask them to go for a calorie deficit diet if possible. That means a low carb diet, or at least for a calorie deficit diet, which helps a lot in maintaining the weight loss. And yeah, obviously stress and depression and anxiety, that is a very, very common factor, and that we have seen is very, very common, and that affects the overall health of the woman, and affecting especially in PCOD patients. We have seen that if at all a woman is very much having hirsutism or acne problem, they are very demoralized about their looks, and they feel that, okay, I don't look beautiful like other friends or colleagues of mine. So we have to sometimes counsel them very properly. If needed, we can take a psychiatrist help, or we can go for send them for a psychiatric counseling if they are into depression or anxiety. Yeah, coming to the mineral part, the food what we consume, when we will take the dietary history, we have to make sure the patient is having a proper diet, and the source of the diet, what are minerals she is consuming in her diet. So many studies have shown that especially minerals like chromium and zinc and all, they have a very good effect in weight loss. And that many studies have shown that chromium itself, it increases the glucose tolerance factors, which helps in normalizing the blood glucose level, especially in a woman who is PCOD plus she is prone to develop type 2 diabetes mellitus. Yeah, zinc, just now I mentioned that during COVID pandemic, we all, I am very sure, would have consumed zinc and vitamin C in good amount, and we know what are the benefits zinc has. Other than zinc having immunity booster factor, it has other plenty of good good things. And like in many research, they have shown that the zinc consumption during PCOD patients, if they take it, decreases the insulin resistance, and it helps in the oocyte quality, and it also helps in ovulation, and it helps in weight loss also in a woman with diabetes mellitus. Vitamin D and calcium, we know it has already been proven that it is very good for egg maturation and follicles to develop. Vitamin D is a god vitamin, and we have been, being a woman, we have been prescribing to all the women of age group of starting from the adolescence till they attain their menopause. Vitamin D has always helped them at all the stages of their life. So why not here in PCOD? Obviously in PCOS also it has shown a very good effect. It decreases the insulin resistance, and in many infertility patients, we have prescribed vitamin D and we have seen a very good results. Coming to vitamin B, yeah, again, vitamin B, B2, if we talk about it, it converts the dietary fat, protein, and carbohydrate into energy. And vitamin B3 helps in maintaining the normal blood sugar level. Vitamin B5 helps in weight loss due to ability to control the fat metabolism. B6 plays a critical role in maintaining the woman's hormonal balance. In addition to that, B2, B3, B6 are essential for normal thyroid function. As I told in the very beginning, that PCOD carries many other diseases associated with that. So among all of them, hypothyroidism is again a very common disease. What we have seen, it's like they are brother and sisters of each other. If a woman is obese and she is PCOD, and if we investigate, out of 10, we have seen 4 to 5 women, they have associated subclinical or all clinical hypothyroidism. Coming to the weight loss aspect, as I told, 5 to 10% of the weight loss, even over the period of 6 months, that has helped the woman in a lot in PCOD. And the few things what I would like to suggest to my patients are that you have to make sure that the frequency of the exercise, what you do, it has to be very, very consistent. I mean, you should not be like, okay, I work out once in a week. No, it's not going to help you. You have to make sure that the frequency of workout has to be at least 5 days in a week, and intensity of the workout has to be moderate. If it is mild, you are just doing some sort of breathing exercise, it is not going to help you. And the duration of the exercise or workout physical activity, what you do, it has to be minimum of 30 to 45 minutes, and you have to be very consistent. And you have to have some faith, and you have to keep very patience. You cannot just go for any exertion or any strenuous exercise which your body cannot tolerate, and from the very next month you will be like, okay, I'm full tired, I cannot work out again. So you have to be very consistent, and it has to be gradual process. Weight loss is always a very gradual process, and you have to be very sure about that. yeah, weight loss, obviously we mentioned that it decreases the insulin resistance, it helps in metabolic features, and it improves the reproductive function of the woman. Dietary modification, other than adding the minerals and vitamin C and vitamin D, we have to ask the patient to go for a low calorie diet and low carbohydrate diet. And however, we have already discussed the efficacy of the low fat diets for PCOD varies starting from the very beginning, from the teenage period. We have to tell them that what sort of food they are supposed to take. We should avoid junk food. They should avoid food with high starch, and especially like junk foods, pizzas, burgers. Such things has to be avoided from very beginning. It is a lifestyle change, so it has to be kept in our habit, and that is when we can maintain it for a very longer period. If we do it for 1 or 2 months and then again we come back to our previous type of dietary habit, then it is not going to help us. As I discussed, yeah, calorie deficit diet, it helps a lot. Starting from a low carb diet, it will help directly from the normal food habit what we have been following for past 5 to 10 years. And if we jump to a keto diet, it is obviously it will help for immediate weight loss, but it is not going to sustain for a longer time. So you have to do a gradual dietary modifications, and starting from that, the very basic thing what we can advise to the patients is they can go for a 70% cut down of the carbohydrate what they take. So we have to tell them that go for a low glycemic food diet. I mean the food what has low glycemic index. So just a brief about the glycemic index. Glycemic index is a measurement of how quickly a particular food raises the blood sugar level. So it has three categories starting from 0 to 55, which we call it as a low glycemic index, 56 to 59, which is medium, and 70 plus is high glycemic index. These are few examples of the categories of food with their glycemic index, so that we can advise the patient and tell them that what food habits and what type of food if you take will increase the glycemic index of your body and glucose content of your body, and that is why you should be avoiding. Especially many of the patients, they think that cornflakes, that Kellogg's cornflakes, that is very healthy, and diabetics also they can take it. But yeah, I understand that is healthy compared to parathas what they are taking, but when it comes to about glycemic index, we have seen that especially cornflakes, mueslis, they have very high glycemic index, especially white bread and all what they take. For many people have a habit of taking white breads in breakfast. So if you see here, white bread has a very good glycemic index, very high glycemic index. So that is why we always encourage our patients to have green leafy vegetables and seasonal fruits. Like they should go for broccolis, they should go for apple, they should go for cucumber, lettuce. All such kind of foods, they have very low glycemic index, and they are very filling also because they are full of fiber. So you will not get the hunger pangs. I mean, after just having a breakfast, after 1 hour you will not feel hungry. That is why here comes the importance of the high fiber food. That is why a woman, if at all she is on any PCOD diet plan, we make sure that we add fiber content to the diet. Otherwise, she will definitely feel very hungry after having, after 1 or 2 hours of her last meal only, she will start having her hunger pangs. So ideally, it is advised that 40% of the dietary fiber has to be added in a woman who are going for a PCOD diet plan. So these are few examples of the diet food what having high fiber content. Especially here we can see that very commonly whole grain has very high fiber, green leafy vegetables, coconut and orange, and then prunes, broccoli, spinach and beans and peas. Such food items, they have very good fiber content, and that is why it has to be advised to the patient. benefits, obviously it has many benefits. As I told, it decreases the hunger pangs, it is very filling, and decreases the insulin resistance, it lowers the blood cholesterol level and blood sugar level also, it decreases the blood pressure, and it aids in the weight management, and it helps the patient to lose weight. And most important, especially if any woman who is put on any sort of diet plan, they have this very common complication of constipation. So especially here comes the role of the dietary fiber. Many times we have seen, we have advised patients additional, isabgol husk and powders also in such patients if at all they are not taking the dietary fiber properly. Yeah, again, as I mentioned, that carbohydrate deficit food helps a lot. So here comes the role of the protein. Protein, again, it plays a very vital role, especially when a woman is planning to lose weight. So healthy, high protein food such as nuts, eggs, dairy products, meats, and seafoods, they are very good for weight loss, and they can really help in losing weight. Healthy fat intake, again we have two categories of fat, one is bad fat and one is healthy fat. So we have healthy fat options also available, so that also we can advise to the patients. So such healthy fats we can get from avocados and olive oils, coconut and peanut butters and all. So they have good protein content, and those fat products are also very they are categorized into good fats, as shown in this picture. And bad fats are corn oil, beef, and red meat, and soya bean oil. So we all know about it, and why you need a fat for the production of hormones, which regulates the hormonal function. And it's obviously, we know the fat soluble vitamin absorption is very important. That is why fat has to be there in our food, especially vitamin D, E, and K, and A. For proper functioning of the brain also, and especially for the healthy and shiny skin, fat content in our food is very important. Coming to the fermented foods, women with PCOS have very healthy gut bacteria. And the gut bacteria contained in PCOS patients, it's very less actually. So such patients, we have to make sure that we ask them to consume some sort of fermented food items, especially if we talk about this section. I feel South Indians are very much blessed, because most of the food items and the daily staple food what they take is mostly they add probiotics in the form of yogurt to it. So most of the options what you will see is idli, dhoklas, dosas, such food items which are made by adding yogurts that contains healthy bacteria, and that is why it helps a lot. So in such PCOD women, those who are put on any sort of diet plan, we ask them to consume yogurt or curd in any form, and if not, then we add some probiotic supplements also. We have so many options available in the market nowadays. So what are the things what a woman, suppose she is a PCOD, she should be avoiding? As we have already discussed about it, like chocolates, cakes, pastries, junk foods, pizzas, burgers, any red meat, instant soups which contains corn starch, ice creams, and bread, burgers, and soda. Obviously, diet canned food has to be avoided. The important thing about weight management, what we should be knowing, what happens is when the woman who is trying to lose weight, so it helps them in maintaining the weight also, because the thing is, once they will go into the weight loss phase, the body itself will go into the metabolic rate of the body will increase. That is why we have to tell them to avoid any processed food or high sugar content food. And first of all, the woman who is having PCOD, they have this problem of chronic inflammation. The body immunity level is not very good. They are not very good at fighting any disease conditions like common cold, and the immunity level of their body is not good. So we have seen by many studies that Mediterranean diet food, it has helped a lot in women, especially with PCOD, who has a very common risk factor for developing URTIs, or they are very prone to get infection. So Mediterranean diet is nothing but, here we advise them to go for a high fruit content in the diet with green vegetables, and we add some supplements like omega-3 rich food, we give fatty fish, and which helps in increasing the immunity of the person also, and it at the same time helps in the weight loss also. So this is a pyramid of a Mediterranean diet pyramid, and it is very common in Western countries and very widely followed. Because being an Indian, most of us are not keen to go for non-vegetarian diet. So for them, maybe it is not suitable but for them, those who take non-veg, this is a very good diet plan, and it can be followed very nicely for a weight loss in a PCOD woman. So as I just mentioned, that the diet has not to be a very to go for a fat diet, or it should not be like an acute weight loss. It has to be gradual, and it has to be consistent. A woman should not under diet. I mean, if at all they are into diet, that doesn't mean that they should go for any multivitamin, or they should go for any deficiencies. So that will again put the woman at risk of developing infections and having other associated problems. So we have to make sure that the diet is properly made and it has been designed by a proper authorized person, so that they should not have any deficiencies. It should be mainly a calorie deficit and low carbohydrate diet if possible. Eating more vegetables and whole food while reducing the consumption of the processed food will definitely help in reducing the weight. So coming to the summary part of the weight loss, for women with PCOD, losing weight has been shown the reversing their insulin resistance, obviously, and it lowers the androgen level, lowers the inflammation, improves the mood, and improves the energy level. The person herself feels very energetic, energized, always positive, and good with everything, all the symptoms. So exercise, again, as I told earlier, it is very important. It has to be a moderate intensity. If possible, aerobics and cardio exercises are very much advised, and it has to be frequent, and it has to be very consistent. You cannot go for 1 or 2 weeks, 1 or 2 times in a week exercise. It has to be minimum 5 to 6 days in a week's exercise, and minimum for 35 to 45 minutes. And many studies has shown that it helps a lot, especially for weight loss. It improves the insulin metabolism, and it reduces the level of the main hormones and male pattern of hair growth, and it lowers the cholesterol level as well. So what type of exercise? As I just mentioned, cardio, any form of aerobic exercises, especially brisk walking, stretching exercise, jogging, yoga, Zumba classes are there, cycling, swimming, all these type of exercise, they come into categories of cardio exercises, and that is why it has been advertised. Studies confirming benefits of exercise. In 12-week study in which 16 women were put on 16 minutes of cardio 3 times per week has shown that PCOS, they had lost 2.3% of body fat. And that is why I was telling from the very beginning that even 5% of weight loss in a PCOD woman has shown spontaneous conception and spontaneous ovulation. There are 3 S for the PCOS hormonal balance. One is stress management, one is sleep quality, and one is supplementation smart. So as just now we discussed about the dietary modifications and the exercise part, what we advise to our patients, one very important thing come into picture is stress and anxiety management. So here many patients we have seen, especially if they are adolescent, teenage, we have to counsel them. We have to take a proper history. We have to find out if they have any sort of depression or any anxiety disorder, especially if they have any hirsutism or acne or any hyperpigmentation issues, or if they are into some sort of depression. Sometimes being a gynecologist, it is difficult to counsel them. So we refer such patients to a psychiatric counseling as well, where they can go for a psycho counseling, they can give their proper history, and it helps them a lot in recovery. Sleep, again, it is very important, because we all know that at least 8 hours of sleep is very important for a healthy well-being, especially when it comes to PCOD women, because they are already stressed and they are already having high cortisol levels in their body. So they have to make sure that they take proper sleep for a proper recovery. Stress management, as I just discussed, it increases the level of cholesterol. Stress, if a woman is very much stressed, very much into anxiety, having some sort of depression, the cholesterol level, which is already raised in the body, it increases very much later on. And exercise, obviously, it helps in stress management. So other than the counseling part, if we have to tell them that, okay, if you exercise regularly, that is again going to help you in stress management also. Supplementation, as I just told, that this is very upcoming thing in PCOD management. Many things has been advised to be supplemented in a patient with PCOD along with the dietary modification. Very common supplementation we have seen, it's been advertised everywhere on the television, is green tea extract. Green tea has been found to be very effective in any sort of weight loss, and when it comes to PCOD, why not? So green tea has to be added to their diet. We have to ask them that whenever they feel like having any caffeinated diet, they should go for green tea. Green tea is very full of antioxidant, and it helps them in weight loss, and it decreases the hunger pangs also. Myo-inositol, we know that we have been using in PCOD for past so many years, and many studies have proven that it shows a very good result. It increases the ovarian function, and it decreases the estrogen level in the woman. Myo-inositol, as we saw, it helps in hyperinsulinemia. It decreases the insulin level, and that is how it decreases the insulin resistance also. So coming to the supplement, I would like to add few things more here because we have 5 minutes left. Fenugreek seeds, we know, I think it's called methi in Hindi. So fenugreek seeds, if you soak overnight in 1 glass of water, and if you just strain it in the morning and you can have it, that also has helped in weight loss, and increases the function of the oocyte quality and ovarian function in PCOD women. Cinnamon, again, it is very important. We all know it is very full of antioxidant. 1.5 gram of cinnamon, if it is taking on daily basis, mixed with lukewarm water, has helped a lot in PCOD women. We would have heard about chamomile tea, which is available in many, green tea with combinations. Chamomile oil has been added to that, and that also helps a lot. Flax seeds are also very important, good in antioxidant, magnesium, calcium, zinc, vitamin D's, and haldi, that is curcumin, which is also very important. So such women can be advised to take 1 TSF of curcumin powder added in hot milk. So thank you very much. I hope that I have cleared your doubt and you all are satisfied with this presentation. Thank you.
Thank you very much, madam, for this nice presentation and for such nice discussion also. Just give me 1 minute time, ma'am, to check whether any question is there. Madam, one question is, does probiotics help significantly in PCOS, and how to choose the patient to whom the probiotic should be given? So is there any parameters also?
There are no such parameters, but yeah, especially for a woman who is morbidly obese, and if she is having gut dysbiosis symptoms, like she's having dyspepsias and all, such patients, if at all, and she's having belching problem, and such patients, we have seen that because the gut immunity is already very bad in PCOD patients. So we have seen many studies have proven that if we add probiotic, because it contains healthy bacteria, so that itself helps into dyspepsias, and it gives a proper digestion, and it relieves the symptoms of the patient.
Thank you very much, madam. And another question is, ma'am, does all the patients need these OCPs? Because it is rapidly seen that people are getting OCPs randomly. So what is your thought on that or practical observation?
Okay. See, OC pills we don't give in a woman who is planning her pregnancy and if she is having PCOS. OC pills are only given for a woman who is a teenage or an adolescent, and if she has history of irregular cycles, to regularize her cycle and make sure that she gets her ovulatory cycle. So for that reason, we give them an OC pills for at least 2 to 3 cycles. But a woman who is planning to conceive, we only go for ovulation induction drugs. We don't give OC pills to them.
Yes. Another question is, ma'am, although we understood that lifestyle modification is a key factor for this PCOS, but it was also sometimes observed that some patient couldn't lose their weight. So in that situation, what can be done for getting successful pregnancy?
Okay, see, losing weight, as I just mentioned, it cannot be an acute process. It has to be sustained and it has to be gradual. I have seen many patients, they are following keto diet, losing 15-20 kgs in 3 months, and then again gaining the same amount of weight in 1 year. So it has to be a gradual process. If suppose a woman is following all her diet, everything, and still she is not losing weight, then we have to look for psychological factors. I mean, if at all she's having any sort of depression, stress, such factors has to be ruled out. We have to look for any hypothyroid symptoms associated to that particular patient. If at all a woman is having water retention problem, so we have to investigate for the other causes of weight gain. That is why she's not losing.
Thank you very much, madam. Okay, madam, I could not find any other question right now. So thank you very much, madam, for your valuable time and for such a nice discussion on this interesting topic also. And in future also, I look forward for some valuable session with you in another interesting topic, madam.
Thank you.
Thank you
so much for
once
inviting
again, ma'am.
me. Connect everybody. Thank you.
Thank you very much, madam, and have a good day.